Addiction-for-Profit, an outstanding business model for the predatorial actors in the community. Sadly, this is becoming more and more of a phenomenon in our culture, and the Dalgarno Institute's involved with a number of different groups in a number of different sectors, federal, state, local, as well as the not-for-profit and government places. And we're privy to a lot of data and information, and the emerging data coming out on just how prolific and how layered the harms are being done in communities shouldn't be, but it's breathtakingly shocking. Local government data, for example, is emerging more and more as people are recording, and data's been recorded around mental health issues, crime issues, familial and or domestic and or child and violence. All these factors are slowly ramping up in different areas, and the overlay in LGA's, local government areas, with, for example, the legal distributors of addiction-profit alcohol is again remarkable. Of course, junk food's part of the same space, and again, these demographics that are hit hardest are usually the lower socioeconomic. And so the concerns around this continue to grow, and the data, ambulance call-outs, hospitalisations, again, police call-outs is growing, and specifically around alcohol and a growing number of other drug issues is incredible. Of course, with the greater permission models being in play, and people get an idea that illicit drug use is being overlooked, even though alcohol is being monitored more aggressively. It's still problematic, and we're seeing this increase in substance use and the attending issues of that. The harms that are being generated by that are quite staggering. And data from Turning Point's AOD stats, which are a great resource, which is live and online, looking at ambulance call-outs, hospitalisations from substances, and they rate LGAs as well as in different substances and different aspects. It's really important for us to get a handle on this as a community and be more aware of this. We kind of know intuitively that it's going on, but the data is real and it's concerning and it's growing. And I think it's time that we took a far greater interest in this process and were more vocal about looking at what it means to push back against that. And particularly policymakers in local government as well as state government, and the stakeholders that are involved there have to be more held greater accounts in this space, and really looking at the public health dynamics and the public safety dynamics and what that means for the community has to be a consideration, not just the addiction-for-profit actors and what they think they may bring to the economic context. And so again, check out the data yourself, look at it, talk to your local governments, ask them about the data, talk to your state government, state and federal politicians, ask them the hard questions, and let's continue to push back against these growing harms to our community.